So I just want to say welcome and thank you for having us back with you again. It's super exciting to have you here with us. One of the key takeaways that we had from the conference was this idea that kids do well if they can, not if they want to, but if they can. And if we acknowledge that, that means that we actually have to meet students where they are, right? Our starting point has to be different. So one of the questions that we have for you is just, what does this mean for adults? Right? What does it mean to meet students where they are? How do adults need to show up differently and be supportive if we're really going to lean into this idea that kids do well if they can, not if they want to?
Well, what it means really is that different kids are going to be in different places when it comes to different sets of skills, which, it's something in education we've been aware of for a long time. You get a classroom full of kids are going to be at different places academically with all kinds of skills. But sometimes we forget that the same is true with skills that the skills that relate to managing our behavior. So skills related to things like problem solving, and flexibility, and frustration tolerance. And different kids are going to be at different places with those sets of skills. And meeting kids where they're at means making sure that our expectations are within striking distance for students based upon what their skills are. And that means having some differences in our expectations for different students, which is part of why being an educator is so challenging, because you're trying to meet all the needs of all these kids in a classroom at one time when people are at very different places.
I think that's interesting that you said in education, because one of the things that we're hearing that a lot of teachers are like, well, help, what can I do? Like, I hear you, I hear the theory, but if I'm dealing with a kid and they're in front of me and they're very dysregulated and they're overwhelmed with these emotions, what's something that I could start doing today that will help them be able to regulate and even articulate those emotions and work through them?
Yeah, well, of course, you're asking for one thing, but I'm going to give you two. One is that pay attention to when kids are getting dysregulated, because kids, us adults, we humans, we don't get dysregulated out of the blue for no apparent reason. There's some trigger, there's something that occurs that taps into skills we're having a hard time being able to bring forth in that moment. So pay attention, because the worst time to try to solve a problem that leads to dysregulation is right when the problem's happening and everybody's dysregulated. Now, that said, you're going to have some strategies for in the moment. And I will say, I think the most powerful human regulator that we have is empathy. Empathy is massively powerful at helping to regulate another human being. And, empathy doesn't mean really showing you care so much as it means listening. That's the way to show you care. Listening hard to somebody in terms of what's going on for them, what they think, what they feel, what their perspective is, what their experience is. Being heard is incredibly regulating.
Thank you. And one of the things I think about, and we've heard a lot about, is that a lot of times kids right now aren't feeling heard. And I'm wondering, would you consider that one of the top three factors right now that are contributing to what people are calling the youth mental health crisis? Right? Everyone's like, we're seeing this rise of kids who are struggling to regulate their emotions. We're seeing a rise in kids who are isolating. We're seeing a rise of kids who are deciding that, they're going to be chronically absent from school. I'm just wondering, what would you identify as maybe the top 2 to 3 contributing factors to what people are labeling as this youth mental health crisis?
Well, I think the top one is, let's be clear, it's no coincidence that it's coming now on the heels of a global pandemic, when developmentally kids' skills didn't develop at the same rate that they did pre-pandemic, because our human brains are not wired to develop in a healthy way when we're socially isolated. So, you know, that's the number one reason for the youth mental health crisis, is that we have expectations for kids out in the world that they're having a hard time meeting because, you know, they haven't had a chance to develop the skills they need to meet those expectations. So that's reason number one. Reason number two, I think, is even though, you know, we're out of the pandemic, the degree of social isolation that still is occurring is dramatic. And a lot of the points of connection in kids' lives that we used to have don't exist anymore. And trying to fill those through technology and social media is a poor way to fill them, and is leading to exacerbating the crisis. So I would say those things. And then the other thing is, you know, there's a lot of really alarming, upsetting things going on in the world, and youth are absolutely right to be very concerned, worried, upset, outraged, depressed by what's going on in the world. So you put those three things together, I think it's a decent explanation for what is a true crisis right now.
Thank you. And anything you would share, or a last thing, or a parting word for anybody related to how do we create connection, belonging, and health for our youth going forward?
Well, you know, you started off by invoking the philosophy behind our work, which is kids do well if they can. I guess I would just say that let's remember that doesn't just apply to kids, right? Adults do well if they can too, whether that's parents, teachers, helpers, you name it. We're all doing the best we can to handle what the world is throwing at us right now in difficult times. And if we can remember that people do well if they can, we're all doing the best we can, and to approach each other with empathy, with curiosity, without judgment, you know, I think we'll all be in a lot better shape.
Thank you so much.